Back in the late 40s, early 50s, there was a real push in the country to try to make sure that rural communities had access to medical care. And at that time in Henry County, most of the care was provided through individual doctor clinics that acted as hospitals. The Nobles Hospital, Ray Clinic, and some of those were actually operated as hospitals, had hospital beds, but they were not regulated, they were small, and there really was no insurance system to take care of them. So an act called the Hill-Burton Act was established in the late 40s that provided funds, matching funds to communities to build hospitals. And Henry County General Hospital was established in 1953 as a result of a matching grant from the federal government to try to provide a few full-time modern hospital in the community. So some local gentlemen who were very prominent in the community, I'm thinking Mr. Porter and Mr. Van Dyke and some others that were prominent people in the community at that time, got together to establish a hospital. And the way the Hill-Burton Act worked is most of the funds came from the federal government, and it cost about $1 million to build the hospital in 1953. And the local community had only put up 10% of that, I believe, so about $100,000 is all they put into the project. And that allowed them to build a pretty substantial hospital. I think it was around 70 beds, somewhere in there, to build the initial building, which is still here. The main old tower there is the 1953 original building. And so that got it started. I think they worked on it for several years, but it finally opened in August of 1953.
Well, I think it was probably in 1953 we came on the school bus, and at that time I was in the 8th grade at Atkin Porter School, and children from different schools was touring the hospital, and we came and toured the hospital at that time. We was going from a small hospital here to at that time, we considered a huge hospital.
Well, back then it was strictly primary care types of services. Most all the doctors were family practice doctors, although we had John Newman, who was an internist and had cardiac training, W.G. Ray, who was, I believe, a surgeon. So we had some, and Dr. Mobley, who was a primary care doctor, Dr. E.P. Mobley. And they were all on the original medical staff, and interesting group on that medical staff. They had one of the first female physicians in Tennessee, Dr. Veltman, was on that medical staff. We had an early, I think it was Dr. Hauser, I believe was his name, who was a black physician, and so he was an early physician on the medical staff. So we had a kind of diverse, even medical staff starting out. But they basically provided general surgery, primary care, and OB. The family doctors all delivered babies here at the hospital. But about 1959, the hospital growth had required them to expand the hospital. So I think it was 1959. They built the east wing on the building and a new surgery wing. So where we do surgery now is actually part of that construction. And we're already looking at now that we need to replace that, but that building has really served us well. And so that expanded the hospital to a 100-bed hospital, and the building, and that was also marked a kind of a key point. It became the last time that the hospital had to require funds from the local government to fund the hospital. Up till 59-60, it was supported by tax money, and after that time, the hospital became self-sufficient. The advent of healthcare insurance helped that process a lot. But real proud of the fact that over the years, this hospital has been supported by the local community with funding, but has always paid that back over time. And so we really have not been indebted to the community other than at short periods of time during our history. So that was a big key position. And going into the 60s, some of the major things that occurred, obviously a nursing home came into the community in 1963, which is now part of Henry County Medical Center, but at that time it was its own entity. But it also did provide some relief for some of the care that was needed to be provided in the community.
The original building was built here in 1963. It was opened in December. They kind of started on it in 1960. The original building had 34 rooms. It was 50 beds at that time. And when they completed that, they feel like they needed more room. So in 1968, they started building South Wing. South Wing has 16 rooms, and they started East Wing at the same time, which has 18 rooms. And those were completed in 1968.
Also during the late 60s, the ambulance service was established. Up until 1969, the ambulance service was provided only by the mortuaries in town. And in 1966-67, Medicare and Medicaid came into place, and that change really transformed everything in terms of how healthcare is delivered really since then. It really provided some additional funding for hospitals, but it also came along with a lot of requirements for regulations and things like that really made it difficult for hospitals other than a fully accredited and full-service hospital to exist. So at about that time, the Nobles Hospital closed down. They ceased existence, so we became the only hospital in the community. And then we had a formal ambulance service that was established by the county that operated up until the late 70s or late 80s when the hospital, Henry County Medical Center, took over as well.
I came to work at Henry County Medical Center, although it was called Henry County General Hospital then. I started June the 28th of 1971. When I came to work here, the entrance to the hospital was where the emergency room is, in that vicinity anyway. So, and then materials management was the cafeteria back then. So, and we did not have third tower. We had 2 East. 2 East was the biggest floor in the hospital then. And where all the offices are now, down on first floor, was OB and surgery. And we had just opened up a CCU unit after I came to work here. That was a real big change. And it was on first floor, about where the nursery is now. The hospital has just grown so much that it's unbelievable. When I came to work here, I think there was only like maybe 150 people here. And when I left, it was about 800 people that was employed here.
During the 70s, there was a lot of growth in the medical center. There was a lot of patients that came in. We were running very high census during that time. The hospital was fairly successful, and I think that helped establish the breadth of services in the community. We had a high-quality medical staff, which really helped, and so we kind of outpaced some of the other rural community hospitals around us, and I think that was a key thing. The 80s became a little bit different. I think the hospital had been very conservative in its approach to things, had not done a very good job of keeping good reserve funds in place, and got into some financial difficulties in the late 80s. And that was a really key time when people in the community started to question whether we needed to keep the hospital as a locally owned and operated facility. And so I think around 1990 or so, there was really a push to sell the hospital at that time, or consider selling it. They established a committee to look into that. That committee recommended to the county commission that they sell the hospital, and that went to the county commission. But in the process of the hearings on that, the community really rose up and made a big push to keep the hospital as a locally owned and operated hospital. And as a result, the county commission turned down the recommendation to sell the hospital at that time. And I think this was 1990, and so they brought in a professional management company, and they helped to try to get some things organized in terms of the finances, but the hospital continued to lose money during that time, but started getting more on the right track at that time. And then in 1992, the hospital decided to go alone without the management company, and hired me as the CEO at that time to replace the management company. And from then on, we have operated independently. But obviously the 90s and the 2000s, we went through tremendous expansion in the medical center, and that's what's resulted in the facility we have today.
Plumlee Rehab opened in 2001 through a generous donation from Harold and Opal Plumlee and the Healthcare Foundation. We have a skilled unit that was completely renovated in 2001, and then we have this beautiful addition of this wonderful lobby and the gym that is next door. The gym was dedicated to us by Dr. Goulash in honor of his parents.
I came to work here in December of 1998 before any renovations had taken place. And the first thing I asked the CEO at that time was, "You are going to let us renovate, right?" And he said yes. I started working with the foundation, who had gotten a grant, a substantial grant from Opal and Harold Plumlee, and they raised a lot of money to go with that and built Plumlee Rehab Gym. With state-of-the-art technology. We have a lovely conference room and area, Plumlee Rehab. And then we were allowed to renovate every hallway, every room. We originally had 174 beds when I came, but with the push for private rooms, we have now almost a lot of our rooms are private. We are certified now for 136 beds. Approximately 130 people are employed here.
The Plumlee Rehabilitation Center serves as an inpatient therapy facility for patients who need to come here to recover before they return home after their hospital stay. We treat various diagnoses here. People that have had general surgery, had orthopedic requirements needed, or neurological problems. They all have the benefit of coming and staying in home instead of going somewhere far away to receive those services. Plumlee has the honor of having 13 full-time staff members of physical therapy, occupational therapy, and speech therapy. All of our staff members are mostly Henry Countyans, so they're all familiar with this area and friends to the patients that we are treating.
This is a very unique community hospital. I think if you look at the way the hospital's evolved in West Tennessee in particular, and across the state of Tennessee, and even the nation and rural communities, the Hill-Burton Act that established us was used in hundreds, if not thousands, of hospitals across the country. But most of those remained very small hospitals. They were probably put in communities that were too small to establish those. The population of Henry County is such that it was enough to support a full-service hospital. But we did have some foresighted people, I think, in the medical staff and in the community that saw the need and were very aggressive in terms of providing quality care and new services and being fairly innovative. So we were able to establish a breadth of services that you couldn't see in another community. A good example is the Blackwood Cancer Center that was established in early 80s, actually, by the Blackwood family who lost a relative and helped funding that we needed to have cancer services in the community, and we established that center with a linear accelerator, and was really one of the first rural community hospitals to have that kind of service, maybe in the country. And so that was an example of being innovative and providing services and trying to keep people at home so they didn't have to travel out of the community for care. So I'm very proud of the fact that we really doubled the size of the medical center during the time that I was here, and all of the physicians that are on staff here now we recruited into the community, and so and that was really a tough thing to establish, because at the time I came in '92, it was very frowned upon by medical staffs to recruit doctors to communities. It was not the typical way that things were done. It was expected that physicians would come into private groups, recruited by the private groups, and we had to go out and be aggressive to try to save the hospital from financial distress to actually bring physicians into the community. And so we were pretty aggressive about doing our own recruiting, but the medical staff stepped up and the community stepped up to try to save the hospital, to allow us to do that kind of recruiting, and that was a major benefit to saving the hospital. We also were able to establish things like our psychiatric program, which was a major boon to the hospital's census and financial health during the 90s. And then recruiting just a myriad of other specialties has really helped. We had no orthopedics when I came here to speak of. The sad story is that when I got here, about a month or so after I got here, our only orthopedic surgeon committed suicide, and we were left without any kind of an orthopedic service or coverage. And so we had to really build that program from the ground up. Dr. Eugene Gulish, who we brought into the community, really helped establish that program. He came with great experience, interest in staying in a rural community and building a program from the ground up, and that was another key thing to the success of the hospital.
Some of my best memories are of getting to help other people. As a secretary, I didn't always have a lot of patient interaction, but there were times when I was in quality improvement that I helped a social worker, and getting to help provide the patient with what they needed after they left the hospital, if it was home health services or nursing home placement. Meeting those people and being able to help them get whatever it was they needed, that really made me feel good, made me feel like I was a contributing member of society.
We have created more jobs in this community than just any other entity that I can think of. I challenge anybody to say who's created more jobs in the community other than this hospital. When I came to work here, we had maybe 300 people employed in the hospital. In other services now, we employ about 850. There have been documented dozens of spin-off businesses that are here now that weren't here. When I came here, we had one home health. Now we've got 6. We've got a whole bunch of pharmacies. We have physical therapy services. We have home health. We have durable medical equipment companies. Just a bunch of different spin-offs. So that, just from the healthcare standpoint, healthcare is right now behind, I think, manufacturing and some retail business. We're the biggest industry in Henry County, and a lot of people don't realize that we're bigger than agriculture. We're bigger than tourism. And a lot of people don't understand that, and they also don't understand that a lot of that money stays locally because of the number of people that we employ and the fact that we use the local banks and buy a lot of our supplies, our food, and everything else that we use every day from the local community, whereas a manufacturing unit, typically those dollars go out of the community. So I think a lot of people underestimate, because we're a governmental hospital, that somehow we're maybe not helping the community, because we must be supported by the taxpayers, and we're just another governmental agency. But nothing could be further from the truth. We are a viable industry, perhaps one of the most important industries in the community, that really turn over millions and millions of dollars in the local community. The health of the community is better, I think, because of that. If you look at the health indicators, because we have a hospital here, we're not at the bottom. When I first came here, we were ranked about 91st or 92nd worst health out of 95 counties, and now we're up in the 40s or 50s, in terms of ranking. We still have a lot of health issues because of our lifestyles in rural communities and those kinds of issues. The lack of health insurance is still a problem. But the fact that we have health services here that support the local community have been key to improving the health of the community. And that's what our mission is here. Our mission is here to provide care to people and to improve the health and overall quality of life in the community. And so I think we've been able to achieve that and continue to achieve that. There's no question that we serve more than just Henry County, and we don't want to just be a Henry County hospital, because Henry County by itself probably can't support the kind of medical center we have here. So we're very dependent on the region. We consider our primary care service area to be Benton, Carroll, Weakley, and Stewart counties. But that's just our primary, and if you go to our secondary service, we provide services all the way over to Obion County, down to towards Memphis, all the way down into the southern part of the state and over into Middle Tennessee. So yes, we draw a lot of patients. We have a lot of patients that come from Waverly and places like that. So we definitely impact those. We have supported services in those communities greatly, and yes, the future of healthcare for those communities, I think, will be greatly tied to this hospital, because we've seen just in the past 5 years, probably 4 or 5 hospitals just in our region close. And so as these communities lose those medical centers, they have to have care provided to them, and we're going to be that provider, I think, in the future.
Henry County is so fortunate to have a facility of this quality. As long as I can remember, from the time I started working here, there's always been an attitude of we want to improve, we want to offer more services, we want to offer better services, and there's always been that attitude of trying to improve and teaching the next generation, how to care for people and what, how to meet their needs.
I've had a great time with my employment here. I wouldn't have wanted to work anyplace else.